All right. So hello, everyone, and thank you for joining our Stop TB Canada national call. These calls will continue to occur on a bi-monthly basis in an effort to remain connected with our colleagues working on TB across the country. So I hope that you find these calls informative, but also feel that they're open spaces to share your work, your thoughts, and coordinate our efforts. So before I begin, my name is Lee Raithby, and I'm a Policy and Advocacy Officer at Results Canada, where my work focuses on tuberculosis. And in this role, I'm also a member of Stop TB Canada's Secretariat team. So like I mentioned, feel free to put your name, your role, and organization in the chat so we have a better sense of who is on the call today. In terms of the agenda for today, we'll start with some brief updates from the Secretariat as usual. We will introduce the TB Conquerors project. We'll provide an overview of our World TB Day plans and how you can get involved with them. And then we'll open the floor to hear from all of you about your plans for World TB Day. So I want to start by sharing that we're thrilled to have the second cohort of the Stop TB Canada Steering Committee in place. We're happy to see a lot of familiar faces alongside new members who will together provide strategic advice for the network for the year. And we're really grateful to have Tina Campbell, who's on the call today, take on the role of co-chair alongside Dr. Elizabeth Ray, who's also on the call. So congratulations to you both. And to learn more about the steering committee and its members, I believe Alex will be posting a link to a blog post in the chat. Another quick update is that over the past couple months, we've been using our survey report on the impact of COVID-19 on TB programs in Canada as an advocacy tool, engaging with decision makers to discuss what's needed to get back on track to ending TB here at home. And I'll come back to this report shortly when I provide the overview of World TB Day plans, but if you have not yet read the report, you can access it through the link that will also be shared in the chat now. And then another quick update is that we've recently hired Nawang Yanga to drive forward the TB Conquerors project, which was created to provide those affected by TB in Canada with a safe space to connect and share experiences. Nawang wasn't able to make the call today, but she did provide us with a short video where she goes over the TB Conquerors project and outlines ways that you can get involved with the network. So I will just play that short video now. Hopefully the sound works okay.
Hi everyone, thank you for joining us today. My name is Nawang Yanga and I am currently developing the TB Conquerors project. Now before going in depth about what the project is actually about and ways you can help, I'd like to begin with a sort of short introduction about how I came into the TB space in Canada. Well, I am family and friends to various TB survivors, including my mother, who had TB when she was pregnant with my oldest sister while she was in Nepal. My interest in TB was sort of brought out of me by Dr. Amrita Daftari, with whom I completed my master's last year, and my project took on a comparative analysis of TB policies and programs in Tibetan refugee settlements in India and Indigenous communities in Canada. And now I have come here with Stop TB Canada to develop the TB Conquerors project. So now that you've learned a bit more about me and my story and how I came to the Stop TB Canada team and now the TB Conquerors project, I'd like to invite you to learn more about the project itself and different ways you can help. So TB Conquerors is a peer support network for people affected by TB in Canada. This can include people living with TB, TB survivors, families, and friends. It's a space to come together, to share stories, to share resources, to share support with one another, and to share the general experiences in their TB journey. We are based on this idea of togetherness and not feeling alone in your TB journey. As we are in the beginning stages of this network and creating this network and developing this network, we have a Facebook group, which has about 12 members so far. We've also branched out into Instagram and Twitter, and you can find us at TB Conquerors. We also have a website, which you can find at stoptbcanada.com. And as I mentioned prior, our main priority has been outreach. And so currently I am working diligently to establish and maintain long-term partnerships with organizations all over Canada, whether it be refugee centers or whether it be organizations serving South Asian communities. I've also been trying to work with physicians, nurses, researchers, so essentially anyone who is sort of interacting with people who've been affected by TB in one way or another. So in terms of our next steps, I think for us, it's still outreach. And as the network grows, we really, really wish to have events to bring people together and to sort of share the space together. And so we aim to have webinars, we aim to have monthly or weekly check-ins, and if regulations permit, we really, really wish to have in-person events where people can come together and have that in-person sort of feeling. We also wish to have projects where we have photo and video series where we highlight personal triumphs and experiences of our members, not only to raise awareness about TB, but also to end TB stigma and help out with TB stigma, sort of. So there are different ways you can help, and there are different ways you can join this network. First, if you're someone living with TB, if you're a TB survivor, if you're a family or friend, please do join our network. We are very, very, very welcoming. It's a very, very safe space. Again, everyone is welcome. We really, really wish for you to join us. We want to highlight all of your stories, and even if you want to be a silent member, that's completely okay. And for people who work with people affected by TB, whether that be in clinics, whether you work with people in research or in advocacy, please do amplify this project directly by word of mouth or by social media. You can find us on Instagram and Twitter, like I mentioned, at TB Conquerors. You can also find us on Facebook, which we are a Facebook group, not a Facebook page. So our Facebook group is Stop TB Canada TB Conquerors. You can also find us on our website, which is www.stoptbcanada.com/TB Conquerors. And if you have any questions, if you want to have a chat with me, if you just want to connect with me, please email me at tbconquerors@gmail.com. And I will definitely get back to you. Again, anyone who's affected by TB, you are so welcome. We really, really wish for anyone to join this group if you're affected by TB. Thank you.
All right, so as Nawang mentioned in this video, we're working really hard to get this initiative off the ground. So if there are any ways that you can support us in reaching those affected by TB, or if you yourself are affected by TB, please reach out to us. Oops.
Hi, everyone.
Sorry about that. Okay. Yeah, Elizabeth? Oh, you're just on mute.
Yeah. By the end of the pandemic, I'll have it all figured out. There's a flyer for the TB Conquerors peer support group, right? I'm sure I had seen that. I think I actually sent it out to the Ontario TB program managers and a bunch of
yes, there is a flyer.
So if anybody wants something that you can put up in a clinic or have as a handout for patients and families with TB, we do also have that all set to go. So you could get that through the website links there in the Gmail.
Yes, thanks for flagging that. All right. Okay, so we'll now move into the main topic of today's discussion, which is World TB Day. So first, I just wanted to provide a bit of background information about the work that Stop TB Canada has engaged in the lead up to World TB Day. And I'm sorry if you've already heard this, but I'll just go over it quickly. But some of you may be aware of the report that I mentioned previously that we published on the impact of COVID on TB programs in Canada, developed from a series of surveys conducted with TB staff and program leads across the country. And respondents of this survey reported diagnostic delays and individuals presenting with more advanced disease, large-scale diversions of TB staff to COVID-19 work, significant disruptions to active case finding, contact tracing and LTBI management, and declines in quality of TB care during the COVID-19 pandemic. So these findings prompted Stop TB Canada to generate a list of calls to action that are necessary to getting back on track to ending TB in Canada. So some of these calls to action include updating the epidemiological data for TB in Canada, since we're currently working with data from 2017, addressing health inequities in Canada, and renewing political and financial commitments to TB elimination. And after the publication of this report, we shared it with around 70 members of parliament who we identified as being located in regions with higher incidence of TB. So many in the GTA, and then as well as MPs in northern communities where recent TB outbreaks have occurred. So we sent this report. Along with the report, we requested a meeting to meet with them. And so far, we've met with 4 MPs to discuss the findings and the calls to action. And we'll also be using this report to build out our Stop TB Canada World TB Day campaign, and specifically our domestic ask. And this fits really nicely into the Stop TB Partnership, which is the global organization under which Stop TB Canada falls, theme for World TB Day 2022, which is Invest to End TB, Save Lives. And this theme really highlights the consistent underfunding of TB and the need to scale up investments to save lives, especially in the context of COVID-19 disruptions to care. And this is reflected in our asks. So Stop TB Canada always works to include both domestic and global asks, as our mission is to end TB at home and abroad. In terms of our domestic ask, this is pulled directly from the survey report and states that Canada must update its epidemiological data on TB, especially in the context of understanding the impact of COVID on TB, which is why a small organization like Stop TB Canada had to engage in a survey initiative in the first place. And we did include this ask last year, but this year we really want to hone in on who specifically would be responsible for this. So I would like to pause and open up to the group here briefly if anyone has any thoughts on how we might go about realizing this ask. So what mechanisms would we want the government to invest in specifically to make up-to-date data a reality? So if it's a matter of retooling COVID platforms for TB, what COVID platforms exist, who develops and maintains them, that we could present the case for retooling for TB. So I just wanted to open up if anyone has thoughts on how we can kind of make this ask a bit more specific.
Hi, I have a maybe just like a super quick comment on the global ask, if that's all right. One of the things that I was just thinking of in particular is like around the global ask. I think like you've sort of already got, and thanks Lee, by the way, for presenting all this. And I think like the domestic and the global ask, like kind of putting them side by side makes a lot of sense in terms of that approach. And then on the global side, so things like TB Reach, I'm just thinking, just because TB Reach is very fresh in my head because we're writing up the final report for our TB Reach project in Nigeria. So it's like very in my head at the moment. But one of the things that I was thinking is to kind of make it specifically perhaps about like investing in communities, so community-based approaches to TB. You know, not only kind of related to adults, but perhaps also to like childhood TB. And the reason that I'm thinking of that is because just going over the results of this, I know it's only one project, but there was a significant investment by TB Reach in financing like household level case finding, as well as investments in like just things like sputum transportation to the microscopy centers, investments in community-based approaches around gender equality. And so kind of mobilizing groups of women as well as groups of boys and men around gender equality in order to increase access for women to access services on TB screening and diagnostics. So I'm just curious if like maybe we can get a bit more granular and say, for example, you know, the global ask is about, yes, a financial commitment, but like to really kind of amplify community-based systems for TB elimination. I'm wondering if there's an interest in kind of going a bit more or just adding context around that.
Yeah, I love that idea of focusing on communities, and a little bit later I'll show you an asset that we're working on right now where we can actually integrate those stories. If you have a specific case example like that you'd want to include, and then if you wanted to share those stories with decision makers when we meet with MPs for World TB Day, I think having those case examples is really useful. But thanks, Adam. Any other thoughts on either the domestic ask, getting specific about the epidemiological data, or the global ask? I do have a bit of information to share about that, but we can start with whatever you have a comment on.
It's Elizabeth. I think one of the things for the epi data, which we all really need to do the basic program planning to restart TB programs that have been on pause during the pandemic at a really minimal level, and then at an only slightly less urgent level, like the bigger gains we need to make getting closer to TB elimination in Canada. There's two pieces of it, right? There's the provincial territorial epidemiologic data collection that then gets pooled nationally. So it is kind of in those two layers. It's not just the federal government side, although that's definitely a big issue, but also for all of the provinces and territories having, you know, modern, efficient electronic data collection systems that would really enable the whole thing to get closer to real time and more public transparency. So there's the epidemiologic, sort of the infrastructure, the electronic infrastructure to facilitate that. And then I think there's also that element about making that data publicly available, so that all the provinces and territories and the national level would have that information visible electronically on websites, particularly. So I think that means also approaching the provinces and territories, basically.
Thanks, Elizabeth. Yeah, I think last year we didn't engage with the provinces and territories, but we're definitely planning to do that this year. So yeah, looking forward to that, including them. Petra, give your hand.
Yeah, I think it's great that we're having this discussion on the domestic and the global angle, and it's really good that we're making it more specific. Looking at this, though, I have more of a reflection of, can we maybe also rephrase it in our own head? It's maybe internally fine to think about what is the ask, but I would like it to be more of what is the priority that we all can do together, instead of asking someone else to do something for us. Like, what can we bring to the table to improve in both of these areas? What, as Stop TB Canada, have we pulled together? For example, the reports and the data that really shows things can be done differently. And so to just throw the spin a little bit around, instead of making it an us-them issue of having a specific ask from someone else, is really, where do we need to go and how can we bring people on board to get there? This is maybe not really specific, but it's just more of a different philosophy that I wanted to put on the table.
Thanks, Petra. Yeah, that's a great point, and how we can kind of contribute to the solution as well. Anything else on the domestic ask? All right, so you can already see the global ask here on the slide, but so for the global ask, we are going to be focusing broadly on the theme of investment, highlighting the need for Canada to invest in the research and development, as well as the mechanisms, small and large, needed to end TB. So this includes meeting Canada's fair share investment in TB R&D, which was committed to at the UN high-level meeting on TB in 2018, and which Canada has failed to meet previously, as well as investing in mechanisms like TB Reach, and then also the Global Fund replenishment that's happening this year. So that's a big one, but we don't want it to be, we don't want the Global Fund to overshadow the whole campaign, but it is definitely going to be part of it, so that there's room to speak to initiatives like TB Reach, like Adam mentioned. Any quick thoughts before I dive into the actual mechanisms that we're going to be using to share these messages with the public and decision makers? Okay. All right, so the strategy is broken down into 3 audiences, including the public, the sector, and political actors. So in terms of public engagement, we've recently shifted from quarterly newsletters to monthly newsletters, and both the February and March newsletters will amplify events and activities happening around World TB Day. So please share your events with us later today in this session, and then continue to email us anything that you would like us to amplify. We'll also be amplifying events on Twitter, and we'll have a month-long social media campaign sharing content from partners as well as our own content. So please engage with us there. Part of this campaign consists of our grassroots initiative to light up monuments across the country in red for World TB Day. So as we have in recent years, so we'll be sharing posts on social media of the different monuments across the country that were lit up in red and tagging the relevant members of parliament in that region. We'll be hosting a webinar around World TB Day in collaboration with Results Canada. The details are still being finalized, but our initial thoughts are that it would be an open event for the public, and we may also use this opportunity to engage relevant ministers on the impact of COVID on TB in Canada and abroad. We'll be publishing several op-eds around World TB Day on a variety of topics related to TB. We have an interactive learning experience in the form of a Prezi, which I will demonstrate shortly, but it consists of information, videos, and activities for a lay audience to learn more about TB amidst COVID-19 in Canada and abroad. And then we'll also be publishing a TB tracker, which my colleague Lena will be speaking to shortly, which acts as an accountability tool for Canada, keeping track of past commitments as well as the progress towards them. In terms of sector engagement, we're kicking that off right now at our national call. And this also includes sharing events and resources from partners in our newsletters and on social media. Stop TB Canada has a dedicated session at the NAR Union Conference. So if you're planning to attend NAR, definitely join that session where you'll hear from our co-chair, Dr. Elizabeth Ray. You'll learn more about the TB Conquerors group and our progress on these World TB Day activities. Lena also has a separate poster presentation on the findings of our survey report. So definitely attend that if you missed the launch event in November. And maybe I'll just pause and see who on the call is actually planning to attend NAR. If you have any sessions that you want to plug here, we'd be happy to hear what you are planning for NAR, if anyone. We were definitely looking forward to having this session in person, but obviously NAR switched to virtual. So hopefully we can all get together in person sometime soon. But does anyone else have anything planned at NAR that they'd like to share? Or if Elizabeth, you have any other information about NAR?
Not specifically. I mean, there's the Stop TB Canada meeting is happening in sort of in parallel to a Stop TB USA meeting in the same time slot, and then the two Stop TB North American groups are doing the morning session talks, or sponsors coordinated chairing the morning session talks the first morning of the conference.
And Courtney, were you unmuting there?
Yeah, this is Courtney. Somebody reached out to me the other day from the University of Toronto to join them on a panel about Indigenous data sovereignty. And I'm hoping that Tina Campbell will also be joining us for that panel discussion as well. So we're going to have a meeting to plan for that in the next couple of days. And that's Billy Joe Hardy from the University of Toronto, who will be speaking to that. And our research group from the U of A has another talk on that issue as well, and using data governance agreements to ensure legal protections for Indigenous community partners in the pursuit of co-developed research questions. Our research group has a number of presentations that will be there also, including one on zoonotic TB. So I think there will be lots of interesting stuff there. And yeah, I'm just going to plug those three.
Awesome. I'm looking forward to seeing you there virtually, attending those sessions. Anyone else for NAR? All right. So just picking back up on our sector engagement, you're also all welcome to attend Results Canada's webinar, which will be detailed in our next newsletter. And then I will share the final version of the Prezi with you all once it's finalized. But maybe I'll just share my screen now to show you the concept. Oops. Okay, so this asset was originally created for a parliamentary event that Results Canada hosted earlier this week, titled Pandemic Proof the World, which aimed to replicate components of a traditional parliamentary delegation in which we would bring members of parliament abroad to demonstrate the impact of Canadian aid firsthand. And given the challenges of the pandemic and the limitations on this kind of engagement, we had to get a little creative and in how we engage with parliamentarians, and designed this virtual delegation asset. So in addition to the event itself on Monday, all the participating parliamentarians were sent a package of materials to enhance their experience, including a link to this Prezi. And I'll just kind of quickly run through it. But the narrative flow is designed to take you through on a journey from the point of view of someone presenting with respiratory symptoms during the COVID-19 pandemic in Kenya. So they go through the continuum of care, eventually being diagnosed with and treated for TB. We have videos from partners embedded throughout that really bring the statistics of the impact of COVID-19 on TB to life. So I just kind of really quickly go through this, but I can share this version with you if you're interested, and then we'll share the World TB Day with everyone, the World TB Day version with everyone once it's finalized as well. Just get up here. Okay. So I'm currently working to adapt this Prezi for World TB Day for more of a lay audience, and Results Canada is planning to use it to engage our grassroots network of volunteers, as well as use it in some different ways. So like I said, I'll share that asset with you once it's finalized, and you can use it we encourage you to use it in any ways that you see fit for your organizations. Any questions about the Prezi before I get back into our strategy? Okay. All right, so lastly, we have our political engagement. And this will include engaging with members of parliament, provincial and territorial ministers of health, and relevant federal ministers, so likely the ministers of health, Indigenous services, and international development. We still need to work out exactly what the engagement with ministers will look like, but it would be great to have a ministerial address at our webinar, for example, still working that all out. We do know what our MP engagement will look like, however, and we would love to work with any of you on the call who would be interested in joining us. So in the next couple of weeks, we'll be activating our steering committee and the broader Stop TB Canada network to reach out to your member of parliament requesting a meeting with Stop TB Canada network around World TB Day. And to make it super easy, we've drafted a template email that you can use to send to your MP information on how to find your MP's contact information. And if you're interested, you can email them and copy us at hello@stoptbcanada.com. And we'll support you in coordinating the meeting. So including attending the meeting with you, drafting the agenda for the meeting, developing leave behind documents to send to your MP afterwards. And I will share all of this information after this meeting, but just hoping that to have some interest from you on the call to take part in this advocacy for World TB Day. Okay, so now I will pass it over to Lena to provide an overview of the TB tracker that we'll be launching on World TB Day. Lena?
Yep. Hi, everyone. My name is Lena. I'm a PhD student at the McGill International TB Center and also involved with Stop TB Canada. So to tie into our domestic asks regarding the need to update epidemiological data for TB in Canada and also to improve issues around accessibility and transparency, we've decided to launch this tracker on World TB Day just to kind of track Canada's progress towards domestic and global TB elimination goals and hold them accountable to those goals. So I'll just quickly share my screen to show the tracker, which is currently in draft mode. So a lot of things just will be added, but this is what it looks like currently. So it'll just be basically embedded on the Stop TB Canada website, but then you'll be able to sort of scroll through these different indicators regarding TB in Canada, so sort of the epidemiological situation, as well as tracking progress towards funding targets, for example, and other targets that were set either domestically or internationally regarding TB elimination. But yeah, to be updated. And if anyone has specifics around what they'd like to see added to the tracker, I'm open for suggestions as well. Thanks.
Go ahead, Robin.
Yeah, I just want to add and kind of clap to that initiative a little bit more, because I think it's really cool to see the sector coming together and creating an accountability tool. It's not just going to be something that we publish on World TB Day and then leave. We'll update it on an annual basis, so it can really become a resource for the wider sector. And again, it in and of itself is a really great tool for advocacy and engaging with decision makers and others. So thanks to Lena for leading on that, and making a big splash and launching it on World TB Day this year will be really exciting.
Thanks, Robin. All right, so, Elizabeth.
Lena, it may already be there and I just missed seeing it, but one thing that's been really worrying over especially the last year, is stories I've been hearing about an increased number of deaths from TB, and especially younger people. Like we would not expect to see those kind of deaths, in pre-pandemic years. So adding TB deaths to the to the tracker, I think would be really useful to try and see, like, that's the worst possible outcomes of decreased TB care during the pandemic.
Yeah, that's a good point. I for sure want to add TB outcomes, so deaths, but also like treatment failure, treatment success, sort of based on the WHO definitions, if possible. The only issue with that is that it's outdated. So I think the data on outcomes is even more outdated than the sort of latest data in the annual TB report, which is from 2017, but outcomes are from 2016. So I'll put them on the tracker, but it just kind of, again,
so
like
it's going to highlight the problems with outdated information.
Yeah. But thanks for that.
Okay, so I think that's kind of an overview of our plans from Stop TB Canada's side. So now I would like to open it up to others on the call to share your plans for World TB Day, whether you are writing an article, hosting an event, developing social media content. Let us know, and we'll do our best to amplify and increase the reach of each activity. So if anyone would like to share, just unmute yourself and go ahead.
Hi, this is Anne from I'm from the Canadian Thoracic Society. I just wanted to let you know that the 8th edition, the updated TB standards, are currently in press, and we're hopeful they will be available, all chapters available online on World TB Day. That's the goal. So we're striving towards that goal. And so we will do a media release to promote the awareness of our of this publication, as well as an educational webinar, for sure in English, hopefully in French as well, but we'll aim for the English one to be also available on that day. So those are our plans for the time being, and yeah.
Thanks, Anne. And whenever you have any promotional materials for the event and the campaign, definitely share with them and with us, and we can include that in our webinar, our newsletter.
Okay, we'll do.
Awesome. Anyone else? I'm not sure if there's someone from McGill TB Center. I haven't heard if there are plans for the annual TB Research Day again this year. I haven't seen anything. I'm not sure if there's someone from the center, but if anyone knows.
I do know in Ontario that Public Health Ontario is has for a number of years done a sort of annual webinar in their rounds series for World TB Day, and they're hoping to do have the new Canadian TB standards as kind of an anchor for this year. So I may get them in touch with you to see what we could organize about that.
Sure. Okay.
Thanks, Elizabeth. It's Andrea Saunders. I'm a nurse epidemiologist from Public Health Ontario. So thanks, Elizabeth, for that. Yes, we are working on hosting our annual World TB Day PHO rounds, likely the week after World TB Day, just because we know that there's a number of webinars already planned for World TB Day, so not to overwhelm our audiences or dilute our potential audiences. But yes, we are working on identifying some presenters and possible topics related to the new release of the Canadian TB standard. So we'll keep you posted once we have some more details to share.
It's Adam from Plan Canada. So for us, for World TB Day, we have kind of two tracks that we're working with. Because we're a federated global organization, we often sort of focus a lot of our efforts internally on World TB Day, and that's purposeful because the organization itself it doesn't have a singular focus on health, and so we have to actually do a lot of internal advocacy even within our own organization to kind of raise profile specifically on TB. We do encounter some issues where, sort of internally, people often ask us why we're doing work on TB. What's the relationship to, say, for example, gender equality and girls' rights? And so we have to kind of make sure that our internal advocacy is done on a regular basis to make sure that we're always aligned on that. Externally, we're doing some thinking, but we don't actually have any concrete plans. And maybe this is where this group could be really helpful. So externally, we were sort of thinking that it might be interesting to do something en français, if possible. If there's like a group of sort of people who, say, wanted to get together and perhaps talk about the kind of global angle on, for example, gender transformative approaches to, global TB work, that perhaps would be one angle to pursue. But if there are other organizations out there that have an interest in maybe doing something related to that, really on the kind of global health delivery track, perhaps related to sort of gender equality and tuberculosis, that'd be great. But we can always brainstorm other ideas too. I think the piece in French is that we were just sort of thinking there's a lot of English content on World TB Day. So would it be possible to do some sort of, say, panel discussion or presentation of results in relation to that in French? So those are, sorry that we don't have a fully baked idea to bring to the table. It's mostly like, here's what we were thinking, but if there's any reactions to that, happy to talk about it more.
Thanks, Adam. Yeah, I love the idea of having an event in French. I think that if it is an open event, it would be something that our French volunteer network at Results would be appreciative of also. So yeah, we'll get in touch on the details of that.
Sounds good.
Robin?
Yeah, Robin with Results Canada. So I posted in the chat that Results Canada volunteers, we activated them in December of last year to start reaching out to potential monuments to light up in red. And last year we did a really big, strong push around this activation as well, and had more than 40 monuments lit up around the country, which was like the most number of monuments lit up in Canada ever. So we're really leaning into that effort again, which is exciting. We're going to do media around it. We're going to do our public awareness raising type webinar that we've already talked about. Something we didn't talk about as a group, though, that I think could be really valuable, and that kind of comes off the back of your comment, Adam, is so Stop TB Canada. We've got some events happening. We've got some resources to share with everyone if you want to roll them out in your own ways. What else could we do to support your work on World TB Day? I guess we want to amplify all of your awesome work, so we'll do that if you send us the information. If anybody ever wants to use the Stop TB Canada logo on their content, that's something that's open to discussion and really warmly welcomed as well, because we really want to make sure that Stop TB Canada, as it builds and grows, is building as a community effort. And then the last thing I was thinking that we didn't talk about is like, what about Stop TB Canada, the Secretariat and Steering Committee, coordinating some meetings, roundtable discussions with decision makers or colleagues at the likes of the Public Health Agency of Canada or Global Affairs Canada, wherever we think we want to have some discussions with colleagues, and then opening those spaces up to the wider network to participate and take part in those types of meetings. Is that it? Like, I guess, show of hands, who would be maybe interested in Stop TB Canada, trying to coordinate something like that, and then inviting the network to participate? I saw a thumbs up from Petra. Yes, okay. And Elizabeth. And do we have any colleagues from the Public Health Agency of Canada on this call, or from GAC on this call, that could maybe help help us with that? No.
it would also be really useful if there was somebody from a provincial or territorial Ministry of Health who could be on that kind of a panel, because most TB prevention and care happens at the provincial territorial level. You know, the major work of it at the federal level is Indigenous services, and then to some extent, you know, immigration related, at least within Canada. And then you're right, there's a whole global impact piece.
Tina, I just saw your message in the chat. Are you able to unmute yourself now, or?
Yes.
Okay, amazing.
I apologize if it becomes loud. They're renovating the next offices right next to ours. So, so I work in Northern Saskatchewan as a TB advisor for Northern Intertribal Health Authority, and our organization looks after 33 First Nations on reserve communities. So this year, for World TB Day, we unfortunately can't light up any monuments red. But last year I had gotten the mayor of Prince Albert to declare or proclaim World TB Day March 24th last year. So I'm going to attempt to do the same thing this year and then actually get that advertised in the newspaper and everything else. I've started a mini video series, which my son is talking about TB facts. So his first one was TB in children. The one we're working on right now is TB in elders. So that should be finished and released shortly. And then doing some radio messaging to our Indigenous communities available in English, Korean Dene. And I have also gotten asked to provide an education session for Saskatchewan Lung Health, talking about TB in remote communities. So I'm set to record that within the next couple weeks, and I'm pretty sure it's going to be available online. So when that information comes out, I'll definitely share that with you guys. And I think, and right now we're just launching a TB poster. So anybody under the age of 18 in our communities can enter with a poster talking about, you know, TB, what TB means to them, TB signs and symptoms, and prevention of TB. So we have some prizes available for that, and that the winners will be announced next month for that. So I'm looking forward to that as well, getting the communities involved in TB because we currently have 2 TB outbreaks in our community. So we've been working really hard at responding to those as well. So I'm excited for the next couple weeks. We have ordered a bunch of health promotional items as well earlier this year. So we'll be able to get them out to the communities and hopefully get the TB program workers who administer medications to clients in the communities to be involved with that as well. So if anything else comes up, I'll definitely share with the group.
Thanks, Tina. It's great to hear that you're working on so many exciting projects. And I loved the video with your son in it. That was great. And now I'll just pause and see if anyone else has anything to add for World TB Day or any other updates.
This is Courtney. I have an update that I shared with Elizabeth the other day. A while back, we were talking about ways to legitimize Stop TB Canada's role as a knowledge mobilizing group within the research community. And we joined up with a research team from the University of Alberta as a knowledge user on a grant application that they submitted. And it was successfully funded and ranked very high overall. I can't say it's all attributable to Stop TB Canada, but I'm sure primarily it was. So the focus of that grant is healthcare utilization during COVID-19 for all centralized respiratory health programs in the province of Alberta. So TB is just one of those programs. But going forward as knowledge users on that grant, I said that that team would have access to our network to disseminate their findings and results. And so I think it should be a really interesting project. And I think because I mentioned it a number of times, that there should be a small pocket of funding coming our way associated with that activity as well. So just some good news here.
That's amazing, Courtney. Congratulations. All right, so if there isn't anything else, let's pause. I just want to close by asking if for everyone that knows that they're part of our directory to just raise their hand or use the hand function so we can see how many on the call are part of the Stop TB Canada directory. I think most of our steering committee is on the directory right now. And the reason why I'm bringing that up is because going forward, we're really looking to tap into this network, and we're going to be using the directory to reach out to different people that are involved in TB efforts in Canada to engage in advocacy, for example, the MP outreach that I mentioned previously. So if you aren't part of the directory, please do join, and then that's just another way to stay in touch and get involved with TB advocacy. So I think that wraps everything up. So thank you everyone for joining the call today. We're really excited to see all these plans come to fruition for World TB Day. Continue to share the events as you have promotional materials with us, and we'll add them to our webinar or our newsletter. I keep calling it webinar, and amplify it on Twitter. And then be sure that you're signed up for our newsletter and part of our directory, like I mentioned. Petra, is that a hand or just a, okay, go ahead.
I just wanted to thank you guys for putting this on, because I think having been in 2 years of a pandemic, everyone is knowing the impacts on their personal life, and definitely on TB. We have seen so many disruptions in Canada. And so I think it really is an important year to make some noise here in Canada. So I just wanted to say thanks to putting this on, and encourage anyone who's on this call to think about how you can best kind of spotlight TB, whether it is through some of the activities outlined or even in your own work, because I mean, all healthcare systems are implicated by the pandemic. And if we're not careful, it's going to go even further down. So I really think we together as a healthcare community, and also as TB specialists, we need to really raise the alarm. So I'm kind of wanting to take that color red that's going to go on all the billings and say, let's say that we're raising the alarm with our red. And we're really putting out some strong messages along with the colors that go onto the buildings by saying we are going into the red with our financing. We need more funding, and to really put some strong voice alongside the colors of the building, so that people who are asking, or journalists who are asking, that we have a good story to tell. And I think we need to, as Stop TB Canada, let's work on that story that we are telling this year on World TB Day. And anyone who has a story that they can somehow connect to the red color or to the COVID pandemic, I think that's going to be really impactful this year. So that was my kind of maybe closing thought for people on the call.
Thanks, Petra, for the strong closing message. Appreciate it. Elizabeth?
I want to add one more thing to that.
Yeah.
Which I think that is great, Petra. I think that is a really nice. I think it's really important, but also it's also a really nice hook about going into the red and red alarm and stuff. But for a bunch of other people on the call that I know work in TB programs, like on the ground, and who've been largely redeployed to COVID for 2 years now, I know we are all exhausted But I think one of the other really useful things about World TB Day is the kind of rallying the troops thing for people that are on the front line of TB work or wish they were back on the front line of TB work, even though they've been doing COVID for 2 years, and to be able to say, you know, that work is important. And even after 2 years of exhaustion, your TB work is important. And there's a bunch of colleagues all in the same boat trying to get to the same point of TB elimination. So even if it's just being able to gather up your staff for an hour to sign on to a TB webinar, I think that's if that's all you can do in your program level of exhaustion, that's still really useful because we are going to be coming out of this pandemic, and to try and have us be as much able to take advantage of these windows to re-energize TB programs across the country, we need to be thinking ahead to those hopefully better times. So.
Thanks, Elizabeth. I love the messaging of rallying the troops, and I hope that everyone sees Stop TB Canada as a network to support you in doing that. So always reach out to us if you need any support for your events or anything else around World TB Day. But yeah, continue to stay in touch with us, and we look forward to everything happening around World TB Day. So thanks for joining us today. Have a great rest of your day. Bye.